I'm going to talk about an important subject because this is a question that quite frequently being asked. If somebody is having botox treatment or botulinum toxin injections for cosmetic purposes, can that person reach the stage where he can't do without botox? Or will it make it worse when he comes off botox? Now, what is botox? Botulinum toxin. Obviously, it is an injectable protein complex that is used to treat wrinkles anywhere in the face, or sometimes hyperhidrosis or excessive sweating, or sometimes to change the shape of the face, for instance, to get the jawline in shape. In other words, you call it jawline reshaping, right? Because there are two muscles here and here, masseters. When you inject botox into them, you can get shrinking of the muscles or disuse atrophy. The medical term is disuse atrophy. They shrink and the face shape then will change. Or you can inject botox to, as I said, wrinkles, and they will soften. Or hyperhidrosis is also another indication. Now, botulinum complex, when you use, what happens? The neuronal transmission of impulses, right, from the nerve end to the synapse can get interrupted because botox goes and sits on the synapse and blocks it irreversibly. But after about 5 to 6 months, what happens? The neuronal ending will start regenerating and will develop new synapses, and therefore the neuronal transmission will be re-established. Now, however, when you use botulinum toxin over a period of time, what happens is that this effect starts to last longer. Initially, when you inject botulinum toxin to anybody, the effect will last about 3-4 months to 6 months. But if you have it over a period of, say, 3 years, then you can expect the effect to last for almost even up to a year. Another scenario is that botulinum toxin comes in several forms. One is called botulinum toxin A, the other one is called B. So if you inject botulinum toxin A over a period of time, then if you have that treatment over a period of time, the body can develop antibodies against botulinum toxin A. Then the effectivity can actually reduce. It's not as effective as it has been in the past. In that situation, doctors choose to inject another form of botulinum complex, which might be botulinum complex B. Then, of course, when you inject that, the antibodies will not be effective against the antibodies the body produces, will not be effective against the new type of botulinum toxin. Now, will you really develop dependence or addiction, or can you do there might be a situation where you cannot do without botox? No, that does not happen. Or can you have a situation where you will be worse off? No, you are not going to be worse off, but of course with aging, after a certain number of years, you are not going to be the same. That's a different matter. However, botox is not going to make you look worse because you have had botox. That does not happen. And it also doesn't give you a situation where you cannot do without it and you need to have the treatment. Quite the contrary. So that is the message I wanted to convey from this video. And when you think about the sort of doses we use for cosmetic purposes, it's quite a safe treatment, and the side effects are quite minimal and can be managed well. So therefore, in conclusion, I can say that no, there is no dependency for botox physically. There is no situation where you'll be worse off.